A good doctor is somebody who really, really cares about the patient. Empathy.
What kind of surgeon you wanted to be?
A good one. My children went to a Jesuit school. They have a saying in Latin, ad majorem, which means you should always try to aim high. You should at least, so what kind of doctor would you like to become? Well, you should aim to be the best. But you should realize that you're for sure you will never be the best. And you don't have to be the best, because if you are so full of yourself, you become a different person, you become a nasty person. And this is something important also. Go for quality and all the rest will follow. If you focus on the money, Sean, it doesn't work, because they will say, this guy doesn't care about the patient, it's only the money. But if you're concerned about the money, well, first aim at quality.
What is your definition of a good doctor?
A good doctor is somebody who really, really cares about the patient. Empathy. This is the central word to become a good doctor. And if you care about the patient, well, first of all, you care because you want to help. You want to go with your patient on the road and say, okay, I will get you out of this problem. And if you want to help somebody, you want to do a good job. So a good doctor means if you want to give good help to your patient, you want also good quality. If you ask what is a good surgeon, this is besides being a good doctor, also a good technician. And for this question, I told you I started doing everything. And when I had to do, for example, in my early years, a percutaneous stone treatment, I did this 2 times, 3 times a year. Do you consider yourself an experienced urologist if you do a procedure 2 times a year? No. So what happened? I had a patient which was an indication for a percutaneous treatment. So the day before I was going to bed thinking, oh my God, tomorrow I have this percutaneous treatment, and you don't sleep very well because you're nervous. And then you start on the procedure and you said, oh God, I hope this will go smoothly. And well, okay, I didn't have big problems, but if you don't do this very often, you don't feel happy with this. And I became convinced to be a good surgeon. I think that medical care, surgical care, whatever becomes or became so complicated, we need to focus on a certain field. Which means that nowadays, I don't do anything of that other stuff anymore. I only do prosthetics, penile and sphincter, because I think they are connected. I'm convinced that this is good if you do both. So I do prosthetics and I do, let's say, andrology, which is Peyronie's disease, which is vasectomy reversal. So I only do this, and this gives me a lot of ease in my mind because I know I can do this, because I have a lot of experience.
Big implanters like yourself, as almost always they narrowed it down to be a specialist. Because again, like you said, we need to be specialized in this field to serve better. Because how can I do a good surgery if I do it once?
You have a pancreatic cancer, imagine, horrible. Do you want to be treated by a surgeon who does this once a year?
Oh no.
It's a nightmare. And if this surgeon is your doctor and he says, okay, you have a pancreatic cancer, but I know this operation, I will help you. You as a patient, you will trust. Are you a good doctor? No, because you do not deserve the trust of this patient. And it's the same for us. We do things that we do every day. We have lots of experience. You feel comfortable and you can look the patient in the eye and say, okay, you might have a really difficult problem now because you had already several surgeries that were not done very well, but I will try to help you. But you feel confident that you have enough experience and you can look the patient in the eye and tell him, I care for you, I will help you.
Because what's funny is that when I first started my prosthetic practice, maybe I told you before, but I only focused on the penile implant. All my colleagues were worried about me. They said, Sean, why don't you do something else? Because if you only do the penile implant, then there's a good chance you'll go bankrupt. You won't be able to make money, right? So let me just try. If I bankrupt, it means that I should do something else. But how can I do a good surgery to the patient if I do not have enough experience, and if I am, how I say, scattered around, my mind should be focused on this one. So I would say I really didn't make a lot of money like the others, but I was able to survive and manage my household. I have no quarrel or complaint of my life.
And you're lucky. And you're happy.
Yeah.
That's the most important.
I'm happy because I do what I like the most.
And this is also what is a good doctor, as you explained, something you like to do. And I'm absolutely sure, convinced, your patient will notice that you like your job, that you enjoy your job, and this will make you a good doctor, and you will attract more patients. So we come back to the beginning. Being a good doctor, you should really care for your patient.
I think your patients will know the same way.
Yeah, it's the same.
That you enjoy. All right. Do you like cooking?
Yes.
All right. The next question is, do you like driving a car?
More or less, yes. I'm not a maniac and addict, so which means I do not want to make any publicity. But
the reason why I asked you is that I have been interviewing many of the big implanters and the revered surgeons like yourself around the world. Very commonly, they love cooking. They prefer to drive if they got to. So at least they like cooking or they like driving, or both. I couldn't understand the reason why. I love both. This I found out when I went to the Robert Valenzuela's house party. One of his wife's relative was a pathologist. Yeah. So he joined the party, and Robert loved cooking. I love cooking, so we were doing the barbecue and all those stuffs. I told him, I don't know the reason why, but Robert and I, both of us, love driving and the cooking. The pathologist responded, of course you are. Because you guys are surgeons, you want to be in charge of the situation. Yeah, but
well, my wife often says when I'm in the house, you're not in the operating room, we are, we are not the nurses, so yes. you are not the chief here. So it's not give me the scissors, give me this, give me that, cut, whatever. But the answer is yes, we like to be in charge.
Yes, so June says the same thing. When I'm cooking, I hate if somebody interrupts what I do.
Me too. There's something else. If I operate, I don't want to be disturbed.
Yes.
I need to concentrate, focus. If I cook, it's the same.
Yes.
So I don't want anybody to interfere with my cooking, and I also don't want them to talk a lot, because if you prepare a whole meal, you need to be focused, and you need to be, because you have several things that you are preparing, and so this is maybe a little bit like surgery.
Yes. What's your hobby?
One of my hobbies is music.
Oh.
I like music very much. I reached the highest level in music, so I play music. And what instrument would you think a urologist will play? The flute.
Flute?
The penis in Flemish. The penis in Flemish. There are patients that say, doctor, I have a problem with my flute.
Ah.
Yeah. So, and a flute is like this.
Yes, yes.
So I like to play Baroque music, and I have a Baroque flute. But the problem now is that I don't have time anymore to practice, and my children say, Papa, you should practice again, because for example, when we had a party at the house with the family, it happened that I did a little concerto for the family.
Good.
So this is, let's say, this is maybe, yes, my hobby. And another hobby is, family is my hobby also. So urology, music, and family.